Welcome to Friday's edition of COVID-19. There's been a slight drop in daily cases today, with authorities recording 671 new infections. Now, despite this reality, the launch of vaccinations appears to be offering the tourism industry here and abroad some hope for the future. We have details on that later on in the program. Here first is the broader pandemic coverage. So let's begin with the domestic updates then.
Yes, Sunny. After hitting 700 cases on Thursday, we are not seeing a further rise in infections this Friday, but it's also not a big drop that we're seeing. And as Sunny said, 671 infections were reported as of 12 a.m. this Friday, and that includes 644 domestic transmissions. So that's a drop by 30 compared to yesterday, and the number of imported cases is similar to Thursday. So the country's total caseload has surpassed 108,000, and also 6 people have lost their lives due to COVID-19 in the past day. Now, between last Friday and this Friday, infections have been ranging between the high 400s and also 700 yesterday on Thursday. And we also have an on-week jump by more than 100 infections. So with the recent upward trend, the number of domestic transmissions, the weekly average that is, has now risen to 559. Again, over 200 infections were reported in the capital Seoul as well as in Gyeonggi-do province. Also over 50 cases in Busan. Meanwhile, the capital region is accounting for some 70% of the nation's total infections. And recent surges have been linked to religious gatherings, nightlife entertainment venues, cram schools, and also many social gatherings as well.
I see. And accordingly, social distancing measures have been extended at the current level for not 2 but 3 weeks, I hear.
Exactly, Sunny. The level 2 in the metropolitan region and also level 1.5 elsewhere will remain in effect until May 2nd. And also, authorities decided not to raise the level itself, for instance, to 2.5 in the capital region, but thought of other ways to contain the virus. And here's Health Minister Gov'T with an earlier announcement.
While the current social distancing levels will be maintained, we are aiming to lower the risk of transmissions by enforcing restrictions on certain venues and activities that have led to many infections. We'll be taking a zero-tolerance stance on those who violate key prevention measures.
Nightlife entertainment venues such as clubs and bars in the greater Seoul area and the southeastern city of Busan will be suspended beginning Monday. Officials are also considering the shortening of operation hours at singing rooms, indoor sports facilities, restaurants and coffee shops in the metropolitan region to 9 p.m. if the situation worsens. The government also plans to expand COVID-19 tests, especially for people with symptoms. In the capital region, an administrative order is to be issued that requests citizens to get tested within 48 hours if a doctor or pharmacist recommends getting screened. And if they do not and are found to have the virus, they are subject to a fine and liable for all treatment costs. And let's also get some updates on the global COVID-19 front. In neighboring Japan, the cases have been in the 3,000s in the past 2 days. So that's also a place where tougher measures are being considered right now. And if we take a look at the countries with the 20 highest numbers of infections, we are seeing a rise in Poland, which has surpassed the total caseload of Colombia. And also Iran has now hit over 2 million infections, seeing resurgences of around 20,000 cases on a daily basis. And the total number of infections around the world stands at 134.5 million, and quite a concerning figure in daily infections. Over 822,000 cases have been reported in the span of 24 hours. And those are the updates I have for now. Back to you, Sunny.
All right, so thank you for now. Right, and turning back to local coverage of the pandemic, I have Kim Sung-yeon here in the studio with more on our vaccination campaign and on the presence of a UK variant, that is, over in the US. Welcome, Sung-yeon.
Hello, good afternoon.
Now, I hear authorities here in the country will decide on the fate of AstraZeneca vaccines this coming weekend.
That's right. This weekend, authorities are currently deliberating on the matter at hand. Just on Wednesday, as we know, the rollout of AstraZeneca vaccines was suspended due to safety concerns, and health authorities said they will deliberate on the issue and make an announcement this coming Sunday. Now, on Wednesday, AstraZeneca vaccines were put on hold for people under age 60, as well as special education instructors and school nurses. However, the KDCA did stress the need to continue on with the nationwide inoculation program in Thursday's afternoon government briefing, saying the country had much to gain from doing so. Let's take a listen.
On April 7th, local time, the European Medicines Agency released the findings of its probe into the possible link between AstraZeneca vaccines and post-inoculation blood clots. The agency reaffirmed that the benefits of getting vaccinated outweigh the risk of side effects, supporting the continued rollout of vaccines.
The KDCA said a team of non-government experts will thoroughly review the cases of rare blood clots reported here at home and abroad before making its final recommendation. Now, AstraZeneca vaccine setbacks have taken the shine off the world's vaccination hopes, and here in Korea, public doubts over the product's safety has been growing as well, which could undermine the country's goal of reaching herd immunity by November. The KDCA noted at Thursday's afternoon briefing that it's still confident of achieving herd immunity on time and that they plan to push forward with the vaccination campaign as scheduled without any delays.
Right. Sung-yeon, one final question. Like I mentioned earlier, over the US, the UK variant, that is now the dominant coronavirus strain in the country.
Right. We are talking about the more contagious variant of the coronavirus that originated in the United Kingdom. It is called the B117 variant, and this variant is not only known to be more contagious than the original strain, but it is also possibly more dangerous and associated with a higher risk of death as well. Now, this variant has now become the dominant strain of COVID-19 in the United States, and this was confirmed by CDC Director Rochelle Walensky on Wednesday. We'll take a listen.
Based on our most recent estimates from CDC surveillance, the B117 variant is now the most common lineage circulating in the United States.
Walensky's confirmation was on schedule, with previous predictions that the B117 variant would become the more dominant strain by late March or early April. In late February, the B117 variant accounted for around 11% of all cases, but by mid-March, that had jumped to 27%. Experts believe the B117 variant is more contagious and likely more deadly as well, which could help explain why its increasing prevalence in the U.S. has coincided with a rise in cases despite the speed of vaccinations, which have proven effective against the variant. In addition to new, more contagious variants, experts say relaxed COVID-19 restrictions and increased travel are also to blame for the rising case numbers. All in all, Walensky urged Americans to join the vaccination campaign, warning that each infection case brings more opportunity for the virus to mutate and pose new threats as well.
All right, Sung-yeon, as always, thank you very much for that report.
The pleasure is mine.
Right, baseball season is on here in Korea, with the first games having taken place this past weekend. Now, last year, the season was held in the absence of spectators. And for a glimpse of the event this year, our Jeon Sung-cho is out on location. Hello, Sung-cho.
Good afternoon, Sunny.
Right, Sung-cho, so I believe this is the 40th season for Korea's pro baseball.
Yes, that's why I'm at the Jamsil Baseball Stadium as the 2021 KBO season kicked off last weekend. Well, here I see some of the workers already getting ready for today's event. The game at 6:30 p.m. LG Twins versus the SSG Lenders. I'm very excited for the game, actually. Well, I don't know if you remember last season. Yes, as Sunny mentioned, there were no spectators allowed to attend the games, but for this season, the authorities have gone through a tremendous amount of work and preparations to make this bold move of reopening the stadium to spectators under strict safety and health guidelines. So this area is one of the few areas in the stadium where people are allowed to eat and drink because people are no longer able to drink beer and eat chickens while watching the game inside the stadium. So instead, we have this hand sanitizer gels placed on each table in the area. And one of the big changes this season also is that when a player tests positive for COVID-19, the team will be able to replace the player with other members and keep the season going. If it turns out to be a cluster infection where numerous players all get infected at the same time, then the KBO will convene an emergency board meeting to discuss how they're going to deal with the situation and handle the club that's left shorthanded. Now, look at the weather today. It's so beautiful, perfect weather to watch some games. Well, before and after each game, the entire stadium will be disinfected to keep the virus at bay, and players have also been told not to attend any big social gatherings in order to minimize contact with people as much as possible during the season. But of course, it takes the help and support of thousands of spectators and baseball fans who come out here to watch the games to ensure everyone's safety, right? So the stadium's mask mandate requires everyone, including players and staff members, to keep their masks on at all times, except for the time when the players are playing the game on the field. And also, the stadiums in Seoul will be operating at 10% seated capacity, which means people should have plenty of space in between their seats to keep social distance from each other. You don't want to ignore any of these rules because the KBO will apply the 3 strikes and you're out rule on violators, which means third-time offenders will be kicked out of the stadium immediately. Well, in many parts of the world, attending a sports event is still out of the big question. So I really hope that everyone really cherishes the accomplishment that we've accomplished so far in South Korea and keep up with the momentum building towards normalcy. This has been Jeon Sung-cho reporting live from Jamsil Baseball Stadium, and back to Sunny in the studio.
All right, Sung-cho, as always, thank you for that report.
정부는 올해 초부터 준비를 시작해 스마트폰에서 손쉽게 예방접종 사실을 증명할 수 있는 시스템 개발을 이미 완료했습니다. 이번 달에 인증 앱을 공식 개통합니다.
Amid the launch of global vaccinations, relevant officials are looking into the possibility of easing cross-border travel restrictions via the adoption of vaccine passports, which are already available for domestic purposes in quite a few countries. For more on this, I have Professor Bae So-young from Kyunghee University. Pleasure to have you with us, Professor Bae.
Thank you for having me again.
Right, Professor, let's begin then with an overview of the losses incurred by both the local and international tourism sectors amid the pandemic.
Okay, so tourism industry is largely based on international activities crossing borders. So inherently, tourism industry itself, it's very easily affected by external factors such as contagious diseases, terrorism, or many other international issues. So we call it as volatile nature of tourism industry. So COVID-19, this pandemic, was not regionally oriented, just like any other recent previous contagious diseases, but it swept across all over the countries. So over the last year, global tourism industry has suffered from the losses of over 5,000 trillion won, and the GDP contribution to the tourism industry has cut into half. And also over 62 million jobs have been lost. And in terms of the size of the international tourist, it has dropped by 74% compared to the previous year. and especially the Asia-Pacific region, actually it has shown the largest decline of 82%. And in fact, the remaining portion of incoming visitors, they are more likely related to foreign workers or international students, so which are relatively less relevant to the typical tourism demand.
I see. And staying with that grim note, according to the Korea Association of Travel Agents, 1 out of 4 travel agencies closed doors as of last October in light of the pandemic. We have more on the hardships faced by those in the industry in this report.
Tourism has been one of the hardest hit industries from the blow of the COVID-19 pandemic. With many travel agencies now facing a liquidity crisis, we spoke to a businesswoman with more than 30 years of experience in the industry for a better grasp of the situation.
제가 그러니까 2월 셋째 주부터 연말까지 제로죠. 매출이 제로이기 때문에 직원들이 지금 현재 18명이 나가고 지금 8명만 남아있는 상태고 재택근무를 하고 있는 중이고 저는 이 집을 담보로 빼낼 수 있는 융자는 다 빼내서 제가 작년 9월까지 살아남았고 저는 이제 대출 받을 데도 받을 데가 없어요. 정부에서 뭐 무이자라도 좀 돈을 어떻게 해줘야 사무실을 갖다가 뭐 100평까지는 아니더라도 그래도 직원들이 나와서 일할 수 있는 여건을 마련할 테니까.
Another CEO of a travel agency who's been working in the industry for 15 years says even the few people who have booked a trip are often unable to travel due to border restrictions and other obstacles.
다 예약하신 분들이 뭐 코로나로 인해서 들어오지를 못하니까 다 자동 캔슬이 된 거죠. 그래서 매출이 하나도 일어나지 않은 그런 상황이 돼버린 겁니다.
Mr. Kim says the government must think a few steps ahead and move quickly to support the ailing tourism industry during and also after the pandemic.
만약에 격리를 없애고 백신 여권을 발급받아서 오는 사람들한테 오게 되면 우리가 방역은 어떻게 해야 되고 또 어떻게 그 사람들을 응대해서 정부에 맞는 정부와 같이 합쳐서 어울리는 시스템을 만들어낼지를 지금부터 고민해 봐야 되지 않을까. 빚에 대한 유예를 조금 1년이라도 유예를 해줬으면 참 좋겠고요. 그 다음에 리셋 비용이 좀 필요할 것 같은데 그런 거에 대한 대출도 정부에서 어떻게 해줄 수는 없는지 그런 게 저희한테는 간절히 필요한 겁니다.
As we just saw in the video, Professor Bae, the hardships suffered by these people are quite extensive. Now, having said that, I understand the launch of vaccinations is blowing winds of change over the tourism industry. Tell us a bit about this.
Okay, so from the 1st of April last week, Korea has started vaccination to the people over the age of 75. So the government aims to vaccinate over 12 million people by June and hopefully to achieve the herd immunity by November this year. So as the vaccination is being accelerated like this, so there are active discussions going on related to so-called travel bubble and also vaccine passport. So such encouraging situations for travel and tourism industry to resume. So actually it led to the sharp rise of the travel-related stock price, such as like airline, cruise, or online travel agencies as well. And also, like people's desire of traveling, it's soaring like never before. So under the limited situations, people currently try to satisfy their suppressed needs of traveling by consuming some online travel-related content, or they try to make lots of domestic tourism, but in a very, very personalized and premium way. And also, sometimes they they love the idea of flight to nowhere. So basically, they get on the plane and they spend some time on the plane for a couple hours for the scenic views, but they do not have any landing destinations. And also, some of the travel agencies even started to sell some travel packages, which people can make reservation at this moment, but they can postpone the use of those packages until the corona situations get stabilized.
I see. Meanwhile, Israel is using green passes to people, issuing green passes, that is, to people who've been fully vaccinated against COVID-19, granting them access to places of indoor gatherings. Now, for more on this, I have Sammy Sokol live on the line. Hello again, Sammy.
Hello, Sunny.
Right, Sammy, first then, tell us about the ease in restrictions in Israel as it leads the global race to herd immunity.
Yes, what we've been seeing here in Israel is quite remarkable. Vaccine has been given to those over the age of 16, and you can see the restaurants are currently full, bars, people out in the streets, venues are opening up. We just had now the Easter Passover holiday, and you could see many Israelis going out enjoying this vacation period. And in many of these places, you have to show your what is called the Green Pass, which is actually an app that you have on your mobile phone, and you show it. The problem is, of course, that the children do not have it because they're not being vaccinated. So in these cases, let's say if a child would like to go to a hotel, then they have to show that they went through a COVID test and they have showed that they are negative to this test.
I see. On a more somber note then, Sami, how has the pandemic itself affected Israel's tourism market?
Well, I can tell you that it has been a big blow for the tourism business. In the year 2019, there were 4.5 million tourists coming. And in the last year, tourism has come to a complete halt. There are no tourists coming into Israel. The tourism currently in Israel is Israelis who are traveling in Israel because they cannot travel abroad. But the tourism has come to a complete stop.
I see. Sami, are Green Pass holders able to travel beyond national boundaries without abiding by self-quarantine requirements?
Yeah, but this is only to very specific countries. And you can see, let's say, I'll give you the example of Greece. So Israelis can now fly to Greece, and if they indeed hold this document that says that they have been vaccinated and that they got the second shot, then they're exempt from being in a quarantine. But the problem is that Greece itself is currently there's a complete lockdown in Greece, in all the islands and everywhere. So there's no motivation for Israelis to go there. So they rather stay in Israel. And you also have a similar situation in Georgia, where there's also night curfews. So these destinations are not popular at all for Israelis. So people here are actually waiting for the summer vacation, hoping that things will change.
Right.
Maybe one difference might be the United Arab Emirates with Dubai. And there you do have Israelis going over there.
Right. And speaking about change, Professor Bae, authorities here in Korea are also looking into the adoption of a vaccine verification system like the one in Israel. Yes. How does the presence of such a system look to affect our own tourism industry?
Yes, so Korea will introduce the digital certification system for vaccination this month. And the certificate is also called Vaccine Passport because it verifies the vaccination status as well as the negative COVID-19 test result through the smartphone application. And it could actually further ensure some free international travel in the future. So it is a truly encouraging news for the tourism industry because it's been waiting for this for such a long time. But it will take some time to use this certificate as at the actual vaccine passport because there are many other issues to be addressed in advance. So for example, the specific guideline like what kind of benefits can be offered for the passport holders that needs to be addressed and fully discussed among the countries. And more importantly, unprepared implementation of vaccine passport that would adversely affect the disease control. So because of this overconfidence of vaccine, it can negatively affect this disease control. So currently only 1% of the total population in Korea, they have been vaccinated. So at this moment, increasing the vaccination rate will be the #1 priority.
Right. Meanwhile, back in Israel, Sami, how is the public there responding to the freedom in movement amid the pandemic?
Yeah, well, as I mentioned, we're talking about most of the public that already has been vaccinated. They're talking about removing the limit for being with a mask on, and you can already see in some places people going without the mask. There are experts here that are saying that we have already reached herd immunity. One of the places that are still have had restrictions until this week were the schools, and as of next week, we're going back to schools as normal. I mean, of course, the kids will be with masks, but definitely there's a change. And if I can talk about the whole issue of tourism, I think that there are new ideas about how people would be like to traveling. You can see it in the last vacations. People like to go out to the nature. People would like to be less in contact with other people, like going into a hotel, but getting the keys already inside, less kind of interaction. And this could be a way to motivate people to go out and enjoy tourism and not be in any risk.
Right. Professor Pei, you mentioned this earlier, but what are the tasks that need to be tackled with regard to vaccine verifications to allow for convenient international travel?
Well, so for the successful implementation of vaccine passport, actually the ensuring trust among the users will be the key, because we need to have a consensus that this vaccine passport is safe, secure, and absolutely beneficial. So to do so, the issue of privacy that needs to be handled accordingly, like for example, who will have the access to what kind of data, such as like medical data and private data. So that kind of things will also need to be addressed and fully communicated to the public in advance. And another issue is the standardization of those technology, because it will be a very, very important issue for the effective implementation. So countries will need to come up with an agreed and unified protocol for the effective implementation. And actually, there is another challenging issue related to forgery. So already, lots of fake vaccination certificate has been already actually on sales on the dark web. So that needs to be taken care of. And we also need to think of the possible polarization because of this vaccine passport, because it could possibly divide people into two different groups, the one who has been vaccinated and not. But it may actually limit the freedom of people for the one who has not been vaccinated because of their disabilities or pregnancy or because of their religious reasons or some minor age. So that can be the possible social issues. Another thing is in the workplace, so something like unfair layoff or discrimination can also take place because of this vaccine passport.
Right. Sami, one final question. Keeping in mind what Professor Pei has just said, have you come across any cases of fake green passes in Israel? Has that been a problem there?
Yeah, I can tell you what people are actually doing, because in fact, there is no such thing as a green passport. I mean, we use it in the media. What you actually have is usually a document that people print out from their own printer, and they hold this document. They hold a piece of paper. Let's say they come like this with a piece of paper to the restaurant, and then at the entrance of the restaurant, they should be checking the document and seeing whether it's the same number as you have on your ID, on your driver's license. And in most places, people don't check it. So of course, it's not a document like a proper passport in that sense, the way people might be imagining it. And I can tell you that in many places, businesses themselves, they're not highly motivated to actually examine and see if this particular person is in fact the one who's holding this document, because they want to have business. Having said all this, I think that once you reach a high number of those who have been vaccinated, and you reach almost a situation of a herd immunity, and this is what we're seeing now in Israel, then there's a dramatic drop of those who are actually getting COVID and the spread of COVID. And then the whole vibe is changing quite rapidly in that sense.
Right. All right, Sammy, as always, thank you for making the time to join us live at this hour.
Thank you.
Right then, Professor Pei, you mentioned this earlier, travel bubbles. Now, I understand Korea is actively seeking them with a few other countries. Could you tell us a bit about this initiative?
Yes, so travel bubble actually refers to the mutual agreement on the two-way, quarantine-free international air travel for 2 or more countries. So let's say if you have been vaccinated and you display like negative COVID-19 test result, then that means you are allowed to freely travel to a particular country with no self-isolate before and after trip, as far as Korea and the particular country have prior agreement. So in Korea, the government has initiated discussion for this travel bubble agreement, possibly with China and Australia and Singapore, mainly targeting the popular tourism destinations for Korean people. And actually, the specific discussion has been already made with Taiwan government as well. And however, there are still pretty significant controversy. What if the travel bubbles will sacrifice the safety and security of the citizens? So the close actually discussion will be necessary between like health authority and aviation industry and relevant stakeholders in advance. And also the criteria to determine how safe is safe enough. For example, like how many daily confirmed cases in the travel destination is actually acceptable to say like safe enough. For example, that kind of questions will need to be further addressed.
Right. And in the meantime then, Professor Bey, what are some tangible efforts that can be made to help the tourism industry at the moment?
Well, as you just said, like vaccine passport or travel bubble, it will take so much time for waiting. But as mentioned by lots of travel business owners, and as we just watched from the VCR, so they are like desperate under this prolonged pandemic situations. So first of all, the government need to provide some financial support, such as like direct support or tax relief or some low interest loan or even interest-free loan. Or we can also provide some consulting effort to deal with some of this business risk under the pandemic situations. And also the tourism business currently have faced a strong need to transform the type of their business, fully utilizing technology. So it would be great if they can receive any type of managerial support or financial support to fully establish ICT-based those business environment and also develop their own capability related to this technology. So it will be able to help them to respond to this digitalized and diversified tourism demand in this untapped society. Another thing is, it would be also very much critical to prepare the tourism demand in the post-corona era, because so it will be important to promote Korea as safe destination by like highlighting our medical excellence and also the quarantine capability to ensure the trust for the potential tourist.
Of course. And up next, we bring you the words of more pundits with regard to ways for the tourism industry to stay afloat amid the pandemic and the prospects of the industry beyond COVID-19. Do take a look.
In late February, a group of travel agency workers gathered in front of the Blue House in protest over their livelihoods. They called on the government to protect their basic rights and for measures to support the country's crisis-stricken tourism industry.
백신이 나옴으로써 항체가 생기고 안전해지고 하기 때문에 이 백신이 서로 맞은 나라끼리도 지금 이제 트래블 버블이라는 서로 상호 간에 여행을 할 수 있는 허가를 내줘서 자유롭게 좀 할 수 있는 그런 분위기가 되는데요. 우리도 이제 정책의 변화를 두어서 이제 그러한 비즈니스를 할 수 있는 환경을 만들어주는 게 굉장히 중요하다고 보고요. 방역 수칙이라든지 여행사가 할 수 있는 그러한 그 여러 가지 제도적인 부분을 좀 개선을 해줬으면 하는 게 저희 협회로서는 가장 큰 바람입니다, 지금.
The COVID-19 pandemic will permanently alter the way people perceive travel. with experts forecasting that safety will emerge as the most important consideration for travelers in choosing their holiday destination.
관광객들도 기본적으로 안전한 곳을 찾게 돼 있습니다. 그것이 위생이 잘 되는지, 그곳에 혹시 확진자들이 있었는지 이런 정보에 민감하게 되고요. 본인들이 스스로 자기를 지키려고 하는 노력을 가지고 접근하기 때문에 그런 안전한 곳이 이제 우선되겠고요. 그러다 보니까 특색 있는 관광지가 주로 어떤 것이 드러나냐면 자연이 뛰어나고 또는 힐링이 되는 곳, 이런 한적한 곳, 이런 관광 목적지가 좀 더 부각되고 사람들이 많이 찾지 않을까 이렇게 저희는 보고 있습니다.
Right, Professor, here, local industry insiders are claiming that overseas travel may resume in the first quarter of 2022. What are your thoughts on this?
Well, people's desire to travel have been suppressed for such a long time. But the thing is, to resume safe overseas travel, it will be most important to have people vaccinated as much and as soon as possible, so achieve herd immunity to ensure the safety. And some countries where the vaccination rate is relatively high, they have started to get ready to open their border in the second half of this year or early next year. But it will obviously take time for the whole tourism industry to fully resume. So based on the progress of COVID-19 situations and the implementation of vaccine passport and travel bubble, Korea will need to come up with the strategy to revive the tourism industry as well as fully ensure the safety in this country.
All right, Professor Pei, thank you very much for making the time to join us here.
Thank you so much.
Right then, up next, we are poised to join the regular briefing on the COVID-19 situation here in the local front for this Friday.
4월 9일 Let us now begin our regular briefing on the COVID-19 situation here in South Korea for April 9th, Friday. As of today, midnight, we have 644 new local infections and 27 new imported cases. The total caseload now stands at 108,269. And we have more than 86,000 tests being conducted yesterday. And at the makeshift testing centers at the metropolitan area, we carried out 39,361 tests, confirming 118 patients. And we also have a drop by one in the number of patients with critical or severe conditions. We have 6 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And as for the recent major local clusters, please refer to the released press kits. And here are some details on the status on our COVID-19 vaccines. Yesterday alone, 36,599 people were administered with the first dose of COVID-19 vaccines, and a total of 1,113,666 people have been administered with the first dose. And among these people, and among those eligible for the first quarter, we have also seen our vaccination rate standing at about 85% for the eligible recipients in Q1. And by facilities, at the nursing hospitals, we have also many people being vaccinated, and also at the first responders, we have over 65,000 people being vaccinated so far. And also at the general hospitals, more than 34,000 people have been administered with their first dose. And as for the COVID-19 hospitals, we have administered the drug to about 65,000 people. And also, as for the Q2 eligible recipients, we have the accumulated recipients standing at more than 3.5 million, 350,000, which is about 85% of the total. And we also have many senior citizens who have been vaccinated so far, and we also have about a 38% vaccination rate for the seniors in the nursing hospitals. And also starting from February, we have been giving out the vaccines to those aged over the 65 at nursing hospitals, and their vaccination rate surpasses 61%. And a total of 11,468 cases of adverse responses have been reported after inoculating population, and of them, 11,290 were mild and common symptoms like muscle pain, headache, or fever. We had 111 suspected cases of anaphylaxis, 25 suspected cases of severe cases, and 42 cases of death have been reported so far. And also currently, starting from February of 26th of February, we have seen a significantly drop in the infections at hospitals and nursing care centers, as well as nursing hospitals. And also, starting from 1st of February and until 25th, we have seen about 97.1% of the infection rate, which has been steadily on decline after the vaccination program. And also, until very recently, we have seen that the proportion of these infections stemming from these facilities stand about 2.0% of the total infections. And we are seeing a general increase in the daily tally. However, we have been contributing to a decrease in the number of fatalities as well. However, globally, we have seen a resurgence of the virus. And here in South Korea as well, we are seeing our daily tally hovering over at 600. And this is why we are on special alert. And if you have any symptoms like a fever or cough, please do not go to any public use facilities and get tested as soon as possible. And also, until you get your results, please wear your face mask even at home, and also keep your social distancing measures even at home with your immediate family members. And also, managers of the public use facilities need to abide by the quarantine measures, including ventilation and disinfection on a regular basis. And in relation to the AstraZeneca vaccines and its correlation to the cases of blood clots, here are some international trends. And the EMA has said on the 7th of April has said that there has been a correlation between the AZ vaccination and some rare cases of the blood clots. And they have seen, once again, highlighted the need to continue the vaccination despite these side effects. And in relation to the Korea's news on the resumption of the vaccination rollout, as for the AstraZeneca vaccines, we have had the experts panel meeting on the 8th of April. And today we also had a meeting of our experts. And tomorrow we will also have convened a similar meeting with our panel of experts. And the results will be disclosed during the weekend. And the quarantine authorities would like to note that in relation to the vaccination, we will be highlighting the scientific proof and evidence when we provide information regarding the vaccinations. We will be opening our ears to all of the panel of experts, and we will be providing the decisions based on scientific evidence as well. And as for our aim to reach herd immunity by November and also to reach our vaccination target, we will exert our full efforts. So please have confidence in the vaccination rollout as well and take part in the vaccination program. And on the 26th of February, that is, since when we had the massive rollout of the vaccines, we have also 1 million people who have been receiving the vaccines here in South Korea. Thank you very much for your participation for the sake of your safety and that of your loved ones as well. And as for the many medical professionals who are working at the forefront, as well as public officials, we want to also thank you once again. And starting from the 1st of April, we have been giving the vaccination to people over the age of 75. And as for people with underlying illnesses and chronic medical conditions, we believe that you might have high anxiety over the vaccinations. However, looking back at the COVID-19 pandemic, that is, we have seen that as for the people who are age seniors and also who have underlying medical conditions, they are more susceptible to the virus and they have higher ratio of developing severe symptoms. So we believe that vaccinating is actually the most crucial and the effective measure to protect yourself. And we ask you to also encourage your parents, elderly parents, to get their vaccinations as well. Please note that vaccination can protect yourself, and also it can also protect the lives of your loved ones and your neighbors, and it can speed up our return to normalcy. And once you are eligible recipient for the vaccines, we ask you to take the shots as soon as possible when you have great health conditions. And even after inoculation, please note that you need to wear your face mask, wash your hands on a regular basis, and keep social distancing measures. The quarantine authorities will also exert our full efforts to roll out the vaccinations speedily going forward, and we will be cooperating fully with the local experts and local authorities and the medical experts. Thank you very much.
Right, there was Baek Young-taek with Friday's afternoon briefing. So what did he have to say?
Well, this briefing was mainly focused on the vaccination updates. Yesterday, on Thursday, over 36,500 people, almost 36,600 people have received their first shot of vaccination. And also more than 9,400 people received their second shot. So in total now, there's been more than 1.1 million who received at least one shot of a vaccination, and people already having gotten their second shot. That number stands at above 52,000. And he also had the number of adverse reactions in total since the vaccination program in Korea started in February. That's at 11,468, and most of those were light symptoms. But there are also 111 anaphylaxis, suspected anaphylaxis responses, as well as 25 serious reactions and 42 post-inoculation fatalities. And he also mentioned that out of the first target group of people who are being vaccinated for COVID-19, 85% have now received their shots, and a second group has now 8.3% have received the shot, and the third group, which includes people aged 75 and above, those seniors have 3.2% have received the shot in that age group.
I see. All right, so thank you for that.
Thank you.
Right, health authorities say we are currently standing at a crossroads with regard to the fate of our COVID-19 situation. So do refrain from activities that could turn the tide against us with a fourth wave that may hinder our relative sense of normality. Thank you for watching.